Another successful life extension technique is calorie restriction. When mice, dogs, and even monkeys were fed extremely low-calorie diets that restricted their normal calorie intake by 30%, their lifespans increased by up to 50%, and they avoided most of the age-related diseases such as heart disease, dementia, arthritis, high blood pressure, plaque buildup, and so on. Human volunteers have now begun such low-calorie diets as well, but they are very difficult and unpleasant to follow, and they will take a long time to get results. However, there are now pharmaceuticals being developed that can mimic calorie restriction diets without actually having to drastically cut one's food intake. Another anti-aging pharmaceutical that holds promise is the drug rapamycin. Rapamycin has already been used to keep the body from rejecting organ transplants. However, when used as an anti-aging drug in elderly mice, those elderly mice lived 15% longer and also escaped many of the age-related diseases typically associated with aging. This is really interesting because in the case of rapamycin, it is demonstrating how a single molecule can have a big impact on aging. And it also demonstrates that anti-aging can be achieved even at a late stage in life. Damage done by aging can indeed be repaired even late in life. Another biotech company is working on a compound called TA65. This is also a telomerase activator. It extends the telomeres on the tips of our chromosomes. Remember, as you age, your telomeres become shorter. The shorter your telomeres, the shorter your natural lifespan. Likewise, the longer your telomeres, the longer your potential lifespan becomes. TA65 stimulates growth of telomeres and is now undergoing human trials as we speak. Also, another interesting phenomenon to be aware of is how current medical procedures and treatments will seem barbaric in the near future. Today, medicine treats many diseases similar to trying to rid a building of termites by using a bomb to blow up the termites. Physicians have, until now, used brute force to battle disease, from generalized drugs that harm healthy cells along with disease cells, to knife and scalpel surgeries that cut through and harm healthy tissue along with diseased tissue. Cancer treatments, for example, still rely on either cutting it out, burning it out with radiation, or killing the cancer with toxic chemicals. The problem with all of these treatments is that they also harm normal, healthy cells. Many current medical therapies cause tremendous collateral damage. But through biomedical science, medicine is beginning to develop the tools to intelligently combat disease. As science and medicine is increasingly able to understand exactly how and why a disease progresses, they will be able to develop the tools to custom design treatments based on each individual's genetic makeup and unique metabolism. MIT researchers, for example, have designed a nanoparticle that penetrates into a cancerous tumor and then releases anti-cancer toxins. Meanwhile, surrounding healthy tissue remains unharmed. Purdue University scientists have constructed tiny delivery vehicles that can carry anti-cancer agents directly into cancer cells. Such mechanisms also promise a potential wealth of new, customized treatments for many other diseases.
Lecture continued on the next CD.